So I wanted to start by thanking everyone for taking the time to join us on this webinar focused on advanced emergency care and transportation of the sick and injured 4th edition. My name is Ryan Poor. I'm a marketing manager for the Public Safety Group. And with us today will be Rhonda Hunt, the author of Advanced Emergency Care and Transportation 4th edition. Just to give you an idea of what you can expect on this webinar, Rhonda is going to start off by telling everyone a bit about her background, and then she'll be going through the textbook and some of the chapter by chapter changes within the textbook, key highlights in the book, things like that matter. And then once Rhonda is finished, we're going to pass it over to Tiffany Slider, our manager of content strategy. She's going to talk a little bit about how AEMT 4th edition fits into the marketplace, and then also going over our Navigate packages available for this title. We will also have time for Q&A at the end of this call. So without further ado, Rhonda, I'll pass it off to you.
Good afternoon. As Ryan said, my name is Rhonda Hunt. I actually have been working in public safety for over 36 years. I started out with fire and then progressed to EMS, working as paramedic on an ambulance as well as on a helicopter. And during that time, I've also had 24 years in education. Currently, I'm the EMS program director for Albany State University in Albany, Georgia, but I've worked in many different capacities. And I've also been an author with AAOS for over 20 years. Our new textbook, basically, we have comprehensive content as we normally do, and the digital resources that go along with it are just phenomenal. And Tiffany will be telling you a little bit more about that a little bit later. But the content itself is developed in coordination with the American Academy of Orthopedic Surgeons, and it is reviewed by at least 5 experts in each area throughout the country. The 4th edition obviously delivers the latest medical evidence, and it aligns with our current EMS standards. The key updates that we're looking at overall with the text, obviously COVID-19 is going to be a big part of every new text coming out from 2020 on. And so throughout the book, you're going to see references. The inclusion of the most current scientific recommendations by ILCOR as well as ECC guidelines established by the American Heart Association has been updated to meet all of the 2020 standards. And we also have reviewed and updated statistics throughout the entire book. Without going into each chapter individually, some of the updates that we can expect to see, we have clear objectives at the beginning of each chapter that align with the 2019 National Scope of EMS Scope of Practice Model, as well as the 2021 EMS Education Standards. You're going to see an example in a little bit of an assessment pearls box that we've added. This is something to reinforce assessment priorities in each one of the clinical chapters, something that as an instructor I like to bring out for my students, so we thought that would be a good addition. We also have street smarts boxes that emphasize the soft skills of EMS, things that include empathy, teamwork, and communication, because these are big components of actually performing well in the field and something that you normally don't get in the classroom setting. Looking at the individual chapters, Chapter 1, which we don't have listed here, actually has more on human trafficking, something that is actually becoming more and more prevalent, we hate to say, throughout the country. With the workforce safety and wellness chapter, extensive discussions of pandemic-related material, donning and doffing of your PPE, what is the appropriate PPE, how can we protect ourselves using those devices such as BVMs and nebulizers, things of that nature, with this being an airborne illness. In Chapter 3, our medical, legal, and ethical, we have a lot more discussion on ethics and social media. If you watch TV, if you watch the news, social media is constantly there. It's constantly prevalent. Somebody always has a cell phone. They're always videoing everything that's going on. In our airway management chapter, one of the things that I'm really excited about for our students is a new section on assisting with ALS airway procedures. This actually teaches them how to help a paramedic set up for intubation, what they need to be doing that's going to be the most beneficial to assist that paramedic in being able to provide an appropriate airway for this particular patient. There's also a safety discussion on assisting with ventilations in this chapter in relation to COVID-19. And then our BLS resuscitation, not only is there an entire chapter that's devoted to it, and it's all updated to meet the AHA 2020 guidelines, but everywhere that BLS is referenced throughout the text, which would be, in your cardiology chapters and things of that nature. So you'll see those updates as you go through. All of our clinical chapters, as I said, now include that assessment pearls box. And you can see an example here on the side of the slide, and also pertinent additions of the COVID-19 material. And to go along with this, Cardiovascular Emergencies has added additional material concerning ECGs, 12 leads, as well as your ventricular assist devices, and specifically with the LVADs. Since that is what we deal with more than we do with the RVADs. Neurologic Emergencies has 4 new boxes on recognizing and managing strokes, along with updated seizure classifications. And our Psychiatric Emergencies, which normally included information on PTSD, now includes new material on the effects of PTSD and EMS, not just in the patients that we pick up, but in the providers themselves. All of our trauma chapters also now focus on what we call the XABC approach of managing exsanguinating hemorrhage first. The big thing is controlling that bleeding. And bleeding also includes a new skill drill on wound packing, as well as more information in the content itself on wound packing. In the OB and neonatal care chapter, we've got new material on the effects of substance abuse, physical abuse during pregnancy, complications of post-term pregnancy, and management of postpartum excessive hemorrhage, as well as a lot of other material. Patients with Special Challenges has increased to include more information on topics such as caring for patients with autism, Down syndrome, and again, we bring out those LVADs, as well as home delivery oxygen systems that students may or may not be familiar with. For our new material in Section 10, the EMS operations, it's geared more towards the provider and patient safety. There's multiple new boxes throughout this section, and we also have a new section on individual terrorist and active shooter events, as well as an inclusion of COVID-19 in the discussion of viruses being used as a potential biologic agent of terrorism. And I think with this is the end of our chapter discussion, and I think the next slide is going to be Tiffany talking to you about our market problems.
Great, thank you, Rhonda. That was an excellent overview of the critical updates that we've made. We just wanted to round out the presentation with some information about the student and instructor resources that will support the 4th edition program. Over the years, we've been really fortunate to get to know all of you and have worked hard to really understand the problems that you and your students face. Our goal with the student and instructor resources is to provide a complete solution that supports multiple types of educators and also learners. I just wanted to highlight a few of the market problems that we're attempting to address with the 4th edition. We certainly understand there are way more problems than this, but these are some that I wanted to focus on, and just know that we'll continue to get to know you and continue to evolve our products to meet your needs. Obviously, you all have budgets to work with, and I think you'll all agree that the ability of students to pay varies quite a bit. Knowing how critical budget is when deciding which package to use, we completed extensive research actually last fall about the pricing for this program, and worked with many of you directly to determine the value of every resource in our package. Because of this, you will also see some changes to what's included at each package level, something we'll discuss a little bit more on the next slide. As a result, we will continue to offer our Essentials package that delivers the foundational tools that you and your students need at an affordable price. We will also continue to offer bolt-on resources to anyone who wants to access certain resources that are not included in their package. This includes access to FISDAP resources, interactive lectures, and simulations. In addition to being mindful of budgetary restraints, educators also have limited time to prepare for class and also limited face time with their students. Our integrated educational solutions offer both off-the-shelf solutions and also customizable configurations that facilitate seamless, effective, and efficient training that delivers proven outcomes for a really diverse student population. With the 4th edition Navigate courses, we also have included a comprehensive instructor's guide that's brand new to this edition that provides an overview of all of the assets found in the course and how to integrate them into your classroom. We really hope that you'll find this new tool helpful sort of as a blueprint for your Navigate course. The next market problem I want to focus on is employability. You know better than most that employability is a huge deal and can truly impact the reputation and success of your EMS program. Despite your best efforts in the classroom, new hires often lack the critical non-technical skills they need to succeed in the field, and that puts the responsibility on employers to deliver that in-depth onboarding. We want to provide programs with everything you need so you can confidently make the claim that the students coming out of your programs are ready for the field. A big part of this effort was developing resources that highlight real-life scenarios that focus on non-technical skills that students will need to succeed. Just to highlight a few of these features, Street Smart boxes, as Rhonda mentioned earlier, have been added throughout the book to help bridge the gap between the classroom and the field environment. These boxes further enhance the technical skills that are presented by focusing on things like patient and team communication and also empathy. We've also made updates to our progressive case studies that are presented in every chapter and emphasize critical thinking skills. And to further support the need for improved non-technical interpersonal skills, we've added new content on pit crew, team-based approach, and crew resource management. On the Navigate side of things, we've added interactive simulations that provide learners with techniques that help them develop the knowledge and skills necessary to be successful in the field. We'll talk a little bit more about this later. Lastly, as with all programs, one of the greatest challenges instructors face is a diverse cohort of students from different academic backgrounds and with different levels of competency. Our comprehensive content, as well as our flexible tools and resources, allow students and instructors to adapt their approach as needed. As Rhonda mentioned earlier, the Assessment Pearls box succinctly emphasizes key assessment priorities for each major topic. In addition, critical A&P and pathophysiology content is reinforced throughout. This is something we've been told over and over is a continuous struggle for students, so we wanted to focus on that. Lastly, the readability has been enhanced a bit with a simpler and more streamlined layout and design. Our hope is that you'll see a noticeable improvement in learning outcomes by taking advantage of these engaging and effective solutions and tools that we've put together. Last but not least, we wanted to briefly review the new Navigate package constructs. We understand that as educators, you value the ability to deliver your programs in a manner that fits your unique educational environments and students. Our Essentials package continues to be the entry-level bundle option for organizations that are budget conscious or require only core content to meet your instructional needs. Our Advantage package is our mid-tier bundle that includes features to make the learning environment more engaging and prepare students to pass the National Registry exam and become more than just technicians. With a focus on soft skills like teamwork, critical thinking, and communication skills, this bundle better prepares providers to be compassionate and more engaged with the people in their community. In the AEMT 4th edition Advantage package, our new soft skills simulations have been added, as well as our test prep offering, which used to be available in our preferred package, and a selection of our virtual mentor lecture series videos. Lastly, our Premier package provides a comprehensive solution for high-performing organizations that are committed to educating field-ready clinicians. This bundle meets all the needs of those educating in the hybrid or distance learning setting. The 4th edition Premier package includes powerful resources like our comprehensive interactive lectures, our popular virtual ride-along videos, plus the addition of our complete 13 video series of virtual mentor lecture series videos, as well as our soft skill simulations, If you purchase a package and determine that additional resources are needed, you can always customize your own bundle. So please feel free to reach out to your sales rep if you want to make any changes. As promised earlier, I just want to briefly highlight our soft skills simulations. I'm really excited about this new asset, and I hope that you'll all see the value here. We worked with a group of EMS educators and our sister company Cognito to develop a series of 3 animated interactive conversations that focus on the importance of non-technical or soft skills. These scenarios provide learners with techniques that can be used to improve overall critical thinking, empathy, communication, and teamwork. Learners are placed into a real-life scenario where they can practice their soft skills with patients and with their partners. There are multiple paths that learners can take so they can see the effects that their decisions have on the outcomes of their patients and also how their communication style affects their team dynamics. And what's really, I think, the most interesting is that, this is not a graded resource. This is something that you'll find out has been completed by your students. And depending on the path they take, they'll get very specific direct feedback on why the decisions they made were great and why maybe they could have made better decisions. So it's a really safe environment for them to work on their soft skills. By completing these simulations, learners gain really valuable knowledge and skills necessary to manage real life situations and achieve better physical and emotional outcomes for their patients. I really hope you'll take this opportunity to check out these simulations, and I welcome your feedback. So please send emails to your reps, send emails to us. Let us know once you've had a chance to take a look. Would love to hear what you think. And with that, I'll hand it over to Ryan.
All right, thank you, Tiffany, and thank you, Rhonda. So we are going to do Q&A in a moment. Before we do that, I just wanted to mention that for everyone who attended, you will get an email tomorrow that includes a recording of this webinar, and then we'll also include the PowerPoint deck for this presentation as well, plus a couple other AEMT 4E flyers and resources. So what we're going to do is I'm going to unmute everybody, and if you have any questions for either Rhonda, Tiffany, you can speak up and let them know what you want to ask, or if you want, you can also put your question in the question box.
Hello, I had a question about syllabuses and stuff. With your instructor pack, does it have sample syllabuses and suggestions of sequence and all that?
So we do include, obviously, lecture outlines that provide some suggestions for how to present the content in each chapter. And like I mentioned earlier, we do have that instructor guide that really walks you through how to integrate and navigate into your classroom. We don't have specific syllabuses with regards to exactly how you should break down by hour your curriculum, but you will see in the instructor guide some timestamps on how long roughly we think the PowerPoint presentations will take to go through, how long the interactive lectures are, so you can really plan your time around that. And I know if anyone has interest in, you're teaching EMT and kind of AEMT together, or you have unique needs for certain schedules. I know Rhonda has a lot of input there and has some sample syllabuses that I'm sure she would be happy for us to share with everyone.
Yes, and in fact, I've actually taught, we do a traditional route as well as an accelerated version where students are able to complete EMT in one semester and then AEMT in like an A term in the following semester. And then we also do the traditional route where they do 2 semesters of EMT and 1 of AEMT. So I would be happy to share with anyone the layout that I use for those programs, which chapters I cover at what point, that type thing.
How would we go about getting that?
Basically, if you will just email Tiffany, I'm sure that will be included in what Ryan sends out tomorrow, then she will get it to me and I'll be glad to respond.
Also, I do want to chime in too and mention that when we close this webinar, there is a quick survey too where you can provide your feedback, and in that survey, there's an option to put in any kind of requests, questions you have. So if you want, you can put that in there and we'll make sure Rhonda can get you that material.
Okay. I also had a question with the packages. You have FISDAP that's included in that. Is this price point, is there a certain number of students that will be able to access FISDAP, or is that a per student price?
I might toss this one over to Maury.
Yes, that is a per student price. So the prices do include the FISDAP, and it is per student.
Thank you.
How long do the students have access to the book and material even after the class is completed?
The subscription length for access to the Navigate courses is 365 days. So from the day they redeem their access code, they have a year to access the materials.
Now I have a question specifically about your section test and your quizzes and all that. I was poking around in there. I noticed you could add your own questions. But is the course set up to us to have control over when and how many times they can access, say, a section test or an exam for a chapter?
Yeah, I don't believe we have, unfortunately, Ryan, I don't think we have one of our solutions analysts on this call, but the best bet for you would be to reach out to your sales rep immediately after this, follow up with them, and they will connect you with one of our solutions team members who can walk you through and answer all those questions. I would hate to give you inaccurate information, but there is a lot of ability for the instructor to decide who can access what for how long. There's a lot of customizable features within Navigate. So I think you'll be pleased with the ability of what you can do. I don't want to be the one to tell you the wrong thing. So please do reach out to your sales rep.
Yeah, and I can kind of answer that too as well. You will have the ability on the back end to, as an instructor or lead instructor in your Navigate course, to create groups of students or cohorts. And so you can set up special requirements for certain students or length of time, dates, times. You can pre-enter that in advance so that, you know, your test will launch at a certain date and time. So yes, as Tiffany said, there are a lot of robust features included in the Navigate system as a whole, but I believe that answer to your question is a yes.
Do we have the option of doing a print and a written one instead of online, or?
Yep, there is an ability to print from Navigate, and we have instructions that we could send you over. It's included in the online technical guide, but yes, you can.
Now, for the different levels, EMT and advanced EMT, are all the current skills for national scope included in this course? So every single skill will be addressed and documented?
That would be a great question for Rhonda. Rhonda, can you speak to that?
Yes, there are a few of the National Registry skills that are for EMT that are not included in this text. Things like the pediatric resuscitation or pediatric respiratory compromise, but the majority of the EMT skills are included. It's just that, you know, instead of having an actual skill drill, well, the skill drills are there for things like BVM ventilation. It just does not go through the exact steps that you would have for National Registry. I do use the book from starting with beginning EMT all the way through AEMT. And the only difference is I leave out the pathophysiology chapter and the, you know, all of the medications and things like that that are pertinent to AEMT when I'm doing EMT, and then we come back and incorporate those in. But like I said, the majority of the skills are there, all for AEMT and most of them for EMT.
Follow-up question on the question and answer. You referred to the National Education Standards. They haven't been published since 2009. There's a draft that still hasn't been approved. So my question was, is the 4th edition text based off the National Education Scope of Practice model? And that's the question this gentleman before me, I think, was asking, is the text include all those items in the Scope of Practice model items to do, not what registry is doing?
Yeah, that's kind of similar to what I was asking too, because I want to know if all the skills that can be tested on or questions on will be covered.
Okay, we write not only to the EMS scope of practice, but also to the instructional guidelines. And like you said, it's been quite a while since those have been updated. But as new material is added throughout, you know, research, whether it be through National Registry or otherwise, that's what our medical directors are constantly pulling out and saying, hey, we need to include this material as well. So while I can't say 100% yes, it is covered, I would like to say that I'm probably, you know, 99% sure that everything is that is within that model.
Yeah, I can jump in here. We did, you know, as we were having this program reviewed, we did include a copy of the correct me if I'm wrong, but I believe it was the 2019 was the last revision of the scope of practice. We did have that document circulating, as we do with all of our core revisions, to make sure that we're meeting the AEMT scope of practice. And, you know, to speak to the educational guidelines, that was certainly disappointing for us that those were delayed. Obviously, the conditions could not be controlled there, but we did have a lot of contacts, and we still do, who are deeply involved in that process, and we're able to keep us informed, and we've been part of the review process for all the drafts. So we have been referencing that working, living, breathing document throughout the process, throughout the entire revision. So you'll see very, very up-to-date content across the board.
Thank you.
You're welcome.
And that's also true of one of our medical directors is actually on the board for not only PHTLS, but a lot of the other, because he works with the American Academy of Orthopedic Surgeons, obviously. He actually has the material before it comes out. And so he's also been really big on pointing out specific things and giving us references that we could use that haven't even been published at this point.
My question has to do with the instructor toolkit and the test banks that are contained within. There kind of doesn't seem to be any consistency. Some of the one or two of the chapters have like 4 questions or 8 questions. Another one has 20. And I know we use them quite a bit for students that might be struggling, you know, or having issues in a chapter. We can throw together a quick quiz, another quiz for them outside of the chapter quizzes that are in Navigate. Are there any plans to expand the instructor toolkit test banks?
Yeah, that's a great question. That's come up, believe it or not, about 15 times already this week, and we are making it a very high priority to address it. So there's actually a larger pool of questions that we had written and revised, and the initial set of questions is now available and live in the test bank and also in Navigate. There are some additional questions that are currently being finalized that we plan to have prior to Thanksgiving added in. So you will see, I believe the total questions will ultimately be around 2,300, which is maybe around 600 more than what you're seeing now. So there should be definitely more per chapter. You won't necessarily see an even disbursement across the chapters, and that's just because we have a subject matter expert / item writer who goes through these item banks and really bases the number of questions on the content that's being addressed and what needs to be assessed. So not just writing questions for question's sake, focusing on those more clinical medical chapters with some tougher questions, more questions. So you'll see, less in the intro chapters, but despite that sort of variance across the chapters, we will be adding some additional questions.
And how about formatting of those? I see right now they're all in a doc format, Word doc.
Yeah.
If there's any plans to do Moodle formatted or any other format, or is that up to us then to go ahead and reformat all that stuff?
So we so we'll continue to include in the test bank that you're seeing that you access from my account. We'll continue to include that as a Word document. The current one that you're seeing will be replaced with a more comprehensive version. And obviously, if you're for anyone not using Moodle, we do also have those LMS converted test banks available. Within Navigate, the new items will be uploaded to Navigate. Any instances created previous to that, we'll have to address on a case-by-case basis. But starting around Thanksgiving, we will be able to start out new access with the 2,300 items total. Okay,
thank you.
Yeah, you're welcome.
I have a question about the instructor webpage. They got rid of it in Navigate, where you could bring up every chapter on one page, and you could list everything in that chapter, the quizzes, the tests, and you can set the dates all on one page for all the chapters and all the things within those chapters. And they got rid of it last time. And so now you got to go into each chapter and go into multiple more pages and hit another 20 clicks. Is that coming back? I don't understand why they got rid of that.
Yeah, I'm going to say, I wish we had one of our solutions members who could speak more fluently to this than I can, but I can tell you that our new Navigate was bringing us up to date with the current Moodle platform. We were a little bit behind in the times, and some of the requirements or restrictions in the actual Moodle platform required us to change the layout and design of the way we presented some of our content. So we did work with instructional design teams and a bunch of customers sort of doing user testing and interface research to make sure it was user friendly, but I totally get if you liked it before, it's definitely different. For those of you who were on Navigate 1, that was also a tough change to navigate too. So there's definitely a little bit of a learning curve. My best suggestion would be, if you really want to see things a certain way, and I can't speak to whether or not that's possible, please, like I said before, reach out to your sales rep, or if you're already in touch with one of our solutions analysts, and they can hop on a webinar with you and really walk you through, and maybe there's a customizable way to have it look more like what you're aiming for. I can't really speak to that.
Yeah, I just don't want to have to go into each chapter. So if I have a third of the way through the course, things have changed, dates have changed, and things have to be amended, whether induced or whatever. Now I have to go into each module, in each chapter, and make the adjustments and go through multiple clicks to get through each chapter, and then go into the next chapter versus doing it all in one page like it was before. So if that was a Moodle thing, then I guess it is what it is. All right.
Yeah, you're welcome. I totally get it. Obviously, this is what, we want to make sure we're meeting everyone's needs, and it's hard when we don't own the platform itself. But I absolutely think it's worth looking into. And if we do find out that there's a way to customize that, we can add it to our instructor guidelines to make sure that everyone has access to that information.
Okay. And then on the pricing package, the Premier package, is the FISDAP an extra fee as far as the clinical documentation aspect, or is that still a freebie, if you will?
FISDAP is included.
Okay, so FISDAP testing, is that included in the Premier?
No, it is not.
Okay,
There's really no change. That's always separate, correct? Yep.
No change. Okay, I was hoping for a gift. All
right. Sorry about that.
And I have to thank everybody that worked on getting the AEMT unit exams tested and getting them online.
Appreciate thank you for mentioning that. That's a very exciting new addition that we have, the FISDAP AEMT exams. We're really excited for that.
Hey, Tiffany, Maury, and Rhonda, I just wanted to mention, so for everyone on the call, I did just put Rhonda's email in the chat. She said she's okay with everyone having it. So if you go to the chat drop down, her email is there. So if you want to reach out to her directly, you can do that. Or, like I said, there is a survey when you close this out. If you want, just put it in the question box in that survey, and we can also get to you that way. I did notice a few questions in the question box I just wanted to make sure we touched on. Someone asked about flipped classroom, it looks like we offer for EMT and paramedic. I could say right now that we do not offer a flipped classroom option for AEMT at this time.
Yeah, that's correct. We do not, but certainly, continue to let us know if you think that would be a valuable addition. And if the demand is there to create that, we certainly are willing and able to do that. Or maybe we do a slightly less robust version just to put some more active learning tools in your hands for the AEMT programs.
Could you define what that is?
Flipped classroom?
The flip option?
Sure. Yeah. So, we have our current package, top package level for most of our courses is the Premier. Then we call that our traditional classroom. And what we created a few years ago for EMT and also for Caroline's, our paramedic programs, is the flipped classroom, which
I'm sorry, I thought I heard foot and I couldn't understand. Okay, I got it. Never mind. Thank you very much.
So you don't want me to give my little spiel? Okay, no problem.
Yeah, go on with your little spiel.
Okay.
Thoughts aren't flipped.
Okay, I'll give you a super high level. So the goal is, at very, very base level, to put all of that sort of knowledge gaining and learning on the student and have them get that initial knowledge at home through these interactive modules that we've created. And it really is a blueprint that walks them through how to use every asset, do their reading assignment or listen to the audio book, look at the interactive lectures, view videos. And once they complete that, they're assessed at the end, and then they go to class or the classroom, and they really focus on discussion with the instructor and hands-on practice in the classroom. So it really takes time away from lectures in the classroom and puts the emphasis on hands-on and discussion. So it's a really exciting learning methodology. We've been doing a lot of research on it, especially with the FISDAP Research Summit over the past many years, and have some great data that our marketing team has compiled and put out there. So we're super excited about it, even though unfortunately we do not have it for AEMT, but it's certainly something we'd like to keep talking about.
Well, I do the hybrids my 7th year, and I don't do any lecturing except when we work on labs. So we use all the online stuff, and they do their own students. So that feature might be a benefit for at least our program. I don't know about anybody else.
Okay, great.
There is a question here. Which package do you see as most popular for an AEMT hybrid course, Premier or Advantage?
Definitely Premier. If you know,
Yeah, I was going to.
yeah, go ahead, Moria.
No, I was just going to say the same thing. Premier, based on the robust features that come in Premier with those interactive lectures and the soft skill simulations, that's really going to be the best option.
Yeah, and in addition to the interactive lectures, which again are really just at-home lectures, it's our PowerPoints basically brought to life with narration and some interactivity. In addition to that, new to this edition of AEMT, we also added that full suite that I mentioned earlier of our virtual mentor lecture series videos. I don't know if any of you have seen those yet. We started including them in our EMT flipped package. They're pretty popular. So those are kind of a combination of animations, talking head, you know, scenario walkthrough, and it's kind of like a 10 to 15 minute clip on some of those harder topics that students struggle with, that we kind of hand selected what topics to focus on based on surveys we had done. So that's another really great addition that is included in the Premier package.
And I'll just say too, one more thing about Premier is with all the uncertainty around COVID and just the way that things are right now, that's another reason it's been extremely popular lately. It just offers an additional way to deliver the training that maybe you wouldn't otherwise consider had that not been a consideration before.
And then I think there was a question too about AEMT testing at the national registry level has been pretty lackluster. Have students who use the book been tested? And if so, what are the success rate compared to other versions?
It's a great question. We do not have actual research or numbers to share with you based on people who've used our programs. Most of our data that we would be able to get would be around those who are going to be using our AEMT exams in FISDAP, since those are validated, and we'll be tracking the student outcomes and results there. So we'll be able to have some more data related to that. You know, the best we can do for you for sure is just anecdotal success stories. The fact that we certainly have, you know, a good number of loyal followers with this program, and there's a great reason for that. We definitely offer significantly more than Brady does right now. So I hope you see it as the best possible option. And I haven't heard anything negative about performance on certification exams. I think that, you know, especially with our test prep product, we do a great job providing the tools needed to prepare students for that exam. So although we don't have data, I'm really glad to hear you asking for that. I think that's definitely something that we all in the part of the PSG team really seek to improve on, is continue to capture more and more data to share that with you.
And I did see one other question, I believe. I noticed the prices for the Navigate packages were less in the PowerPoint slide today than listed on the website. Is there a promo code that you are offering?
No, so I can take that one. When you enter a quantity of 10 or more in the website, the price automatically adjusts to the lower, which that price reflected on the flyer is a 25% discount off of list price, and that is what we consider our training site discount. So that we typically put the discounted price on the flyers just so that it's a little bit more straightforward, since most of the programs that we speak with are obviously training entities. Hope that helps.
Okay, as a training outfit, will we always have access to the books? Like we're pretty small. We do one EMT class and one advanced class a year, but I would like to keep personally access to the instructor site and all that in the book throughout the year. Is that possible?
So
absolutely.
Yeah, go ahead, Moria.
Oh, I was just going to say, you know, with your the fact that you have the online instructor resources, you automatically have access to all of those things. They may expire after a year. It might be 5 years for lead instructor, and usually there's a little expiration date when you're in the My Account section of Navigate. But you have access to the ebook as well as all of the features within the instructor toolkit. And if you need access extended, you would just reach out to one of your, whoever your rep is, and they would go ahead and put in the request to have your access extended.
Thank you.
All right. Last chance. Anyone have any last questions before we wrap up?
I saw on the dashboard it has a section for a grade book. I haven't set up a class, so I don't really know what everything looks like in there. But is there a way of downloading some of the information and results to like a spreadsheet or something if I was keeping records that I wanted to store with all my other records? Is there a way of downloading just like the raw data in a spreadsheet form?
Yeah, it is all accessible via a spreadsheet. You can download it. There is, I can't remember where it is exactly that you would click, but I believe it is in the help section in the top right-hand side of the screen where it has technical support, and it pops up a PDF that's 40 something pages long but there's links included to exactly what you need to go to. If you can't find it, reach out to your rep and we'll get you the information that you need. But yes, you can export that information to a spreadsheet for the exact reason that you mentioned.
Yeah, I just wanted to add to that. Thanks, Moria. That is an excellent sort of intro to making sure that you're all aware of our extensive training documentation that was only recently built and put into our website for you to access. So please take a look at that. So that instructor guide I talked to you about before, right when you open up your Navigate course for AEMT, you'll see that instructor document available. And at the very top, I've included a link that directs you to where all these training resources are. And I think you'll be surprised at how much content's in there. And again, anything that isn't in there, the solutions team can certainly help you.
All right, if that's it, I wanted to thank everyone again for taking the time to join us for this. And like I said, when we close this out, there will be a quick survey. So if you have any other questions you want to ask, whether it's for Rhonda or a member of the public safety group team, just drop it in there and someone will get back to you. Thanks for joining, and thanks to Rhonda, Tiffany, and Moria.
Thanks so much,
Thank you,
everyone.
Ryan.
Have a great day.
Thank
See ya.
you.
Bye.